This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Under President Donald Trump, certain words are disappearing or becoming taboo. Earlier this month, the New York Times published a list of terms flagged by the administration to be limited or avoided. Terms on that list include diversity and LGBTQ, but also women, assigned female at birth, pregnant persons, and more. Federal agencies are removing these terms from government websites and memos, but they're also scouring grants for language like this, including at the National Institutes of Health. That's setting off fears that funding could be eliminated or reduced for certain research areas, including reproductive health. Reproductive health has historically been understudied and underfunded in the U.S., but researchers have been working to change that across Connecticut and beyond in recent years. So, how could the new administration impact that progress? This hour, we'll be exploring that. But first, we'll hear about efforts in Connecticut to study diseases like endometriosis. And with me this morning is Michaela Savitt, who's our state government reporter for Connecticut Public. Michaela, welcome back to Where We Live.
Thanks so much, Kat.
And also with us is Dr. Danelle Luciano, who's a professor of obstetrics and gynecology at UConn Health and also co-director of EndoRISE. Dr. Luciano, thanks so much for joining us today.
Thank you, Kat.
And listeners, let us know if you have any questions. Give us a call, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So, Dr. Luciano, I want to start with you this morning. For anyone who isn't familiar with endometriosis, can you tell us what is it and what are some common symptoms?
So, endometriosis is a systemic inflammatory disease that is characterized by tissue that looks like the lining of the uterus growing outside the uterus. And most of the time, this tissue grows in the pelvis, so around our ovaries and tubes and uterus, but it can grow as far as in the lung or in the pericardium. And the most common symptoms associated with endometriosis are pelvic pain, painful menses, and infertility, but it can also cause bowel dysfunction and bladder dysfunction, and it's associated with a lot of other conditions like migraines and irritable bowel syndrome and painful bladder syndrome.
And is endometriosis something difficult to diagnose?
So endometriosis is only diagnosed by, or the gold standard for diagnosis is doing surgery, removing the tissue, and then confirming it histologically. So a lot of times I can guess that a patient has endometriosis based on some of their risk factors and some of their symptoms, but I can't technically diagnose it without surgery.
And historically, has endometriosis received adequate attention and funding within the scientific community?
So endometriosis was first described in 1912, and it wasn't considered a disease that needed to be studied or one of the important diseases for the DoD or the NIH until well into the 2000s, sometime around 2016, 17. So over 100 years later. So yes, it is grossly underfunded and under-researched.
And I believe you mentioned before that we actually couldn't really do much research on women until, I think, the late 70s?
Yeah, because doing research on women, we were considered a protected group. And so we couldn't do research on women. So even like birth control pills, for example, were never tested on women. Some of the older birth control pills were always tested on men, and they just considered us little men and assumed that we would have the same side effects as a man would.
And that's certainly something that we will be digging deeper later on in the conversation as well. And Michaela, I want to jump to you. This is not the first time we're having a conversation about endometriosis, and you've been covering this in depth here in Connecticut. And Connecticut also acknowledged the need for more studies on endometriosis when the legislature actually introduced a bill in 2023 called an Act Concerning Endometriosis. What did this act establish?
Yeah, so that bill was passed in 2023, and it strives to do a number of different things to address endometriosis on a state level. One of which is Yukon Health is working with Jackson Laboratory to study samples from patients who undergo endometriosis surgery, who opt into this study, and they study the samples, the lesions that are removed, and a number of other samples that they take to examine the DNA on a biological level, and be able to publish that or share that. Their findings with other researchers, and ultimately the end goal is to help find a cure and a better way to detect the disease. But it is a way of finding a large number of samples ultimately around the state. So it started with Yukon Health patients, led by Dr. Luciano, but this year. Last month's endometriosis working groups meeting, they announced that 2 other hospitals, St. Francis Hospital in Hartford and Danbury Hospital, are also joining the effort. So a way to expand the number of patients that are being included in this study, and just get a broader, more diverse sample. And the effort also includes advocacy efforts and just getting the word out and educating healthcare professionals and school nurses, et cetera.
Well, and Dr. Luciano, the other part of your life being co-director of EndoRISE is the advocacy efforts and raising awareness and giving a support system to those who need it. Can you tell us more about EndoRISE and what are you and your colleagues working on?
So, as Michaela mentioned, EndoRISE is basically two-pronged. There's the biorepository for which we're collecting tissue, and our hope is to collect tissue to be able to not only do our own research, but more importantly, to be able to distribute that tissue to other research centers so that they can also study endometriosis. And we are part of the World Endometriosis Research Foundation, so we use the same standard operating procedures, ways of collecting the tissue so that we can be part of that global biorepository to increase research on endo. So that's one whole aspect. And then the other aspect is raising awareness and education. So we're educating not only healthcare providers like other physicians, but we're also starting educating school nurses because we know that even though the average age of endometriosis diagnosis is 27, it takes about 7 to 10 years to diagnose it. So many of these women are starting to have their first symptoms in high school, and recognizing that we reached out to the school nurses who are really first line for that and are trying to educate.
Well, with any sort of awareness processes, there's so many factors and moving parts within that program, or not program, but just that movement. It sounds like there's a lot of short-term goals and a lot of long-term goals. Can you talk about where do you hope your work where does it go in the future? And talk a little bit more about the collaboration, who's involved?
So the endometriosis working group that was started by Representative Gilchrist is amazing because it connects researchers, physicians, legislators, patients, patient advocates, and when we're able to all work together, then that's going to allow us to move things forward. And I'd like to believe that endometriosis is kind of going to be the next grassroots movement like breast cancer was, which started out with a bunch of advocates and patients and doctors and researchers and legislators all working together to try to increase awareness. And then that increased awareness increased a need for, kind of pushed legislature to increase funding for research, which then improved research, which then improved our therapeutics and made it easier for us to treat and diagnose breast cancer. And that's what my long-term goal is for endometriosis as well.
Well, and talking about funding, Michaela, Governor Ned Lamont recently announced his 2-year budget proposal to the state legislature. Did he address continued funding for EndoRISE in his proposal?
Yeah, so the governor announced his budget, was it in early February? Mm-hmm. Feels like a while ago now.
It does.
And it maintains the funding through Yukon Health that that funds this endometriosis testing that, again, Jackson Lab and Yukon Health have been doing in the last year. And what this group has been hoping for is to get double that funding because, as I was saying before, they're expanding to other hospitals. There's more samples coming in, and this is under state statute to test more samples from patients. So there's more costs being incurred with that. Right now, we are in the middle of the budget process. There's a lot of different things being considered. We're seeing a lot of different changes at the federal level that were not coming in when the governor's budget team was putting together this 2-year spending plan. So, right now, the Appropriations Committee is developing their spending plan. It'll go through some more review, but it'll be a little while before we know yet. But yeah, it's kind of, we're in the middle of it.
And so we're currently, because like you mentioned, we're still in the process. There's a lot of things going on. Do you know when, or do you have an estimated time when we will know if additional funds for initiatives like EndoRISE are approved, or have a ballpark figure of what that looks like?
Well, this being the longer session of the every other year is a longer session to pass the budget. It's a long process, like I said. So I mean, we're gonna get some recommendations from those committees, and then legislative leaders will have to negotiate with the governor to come up with a final budget. So kind of in late May, early June, I believe, springtime, we'll know more about what's coming through. But again, lots of changes happening. So I think we're going to be, I think there's going to be a lot of things that more requests that will be coming into the governor's office, at least from what I've been hearing week to week.
Right. Well, we'll have to check in with you in a couple of weeks and see, or in a couple of months and see what's going on there. And Dr. Luciano, do you have any specific goals that you would like to accomplish if more funding for EndoRISE comes towards the program, and what do you hope you can accomplish with that?
So our biggest goal is to increase the diversity of our samples. Endometriosis affects 10% of people born with a uterus, and for better or for worse, it doesn't care what your ethnicity is or your cultural background or your socioeconomic status. So endometriosis affects everyone, and so the goal is to get as diverse a sample of tissue as possible. And the more samples that we have, and the better the diversity of our samples. And it's not just the tissue that we're getting, we're also getting data on these patients, because endometriosis is very heterogeneous in how it presents as well. So like symptom-wise and stuff. So it's important that we get all of that and we reach the critical mass amount of tissue and data that we can start distributing these biospecimens and distributing this data and really participating in the World Endometriosis Research Foundation's goals, which are to understand endometriosis in all of its facets from all over the world and how it presents.
And Michaela, before we let you go, anything you want to share with our listeners today? Final thoughts?
Just that, it's really it's really cool to see patients and lawmakers and researchers and doctors working together to try and find better ways to detect, diagnose, and treat this disease. Like Dr. Luciano said, affects 1 in 10 women or people born female. So, this is affecting a lot of people, and a lot of people can't get a definitive diagnosis. So maybe there's even more folks out there that are experiencing, this disease. And it has been underfunded, but has gotten more funding from the National Institutes for Health. I think it was $27 million in 2022, up from $13 million in 2020. But now we're seeing all these threats, as you said at the top of the show, to grants for science research. A lot of that targeting terms like diversity or women or any other things. So. It's a concern for people in the health and science and advocacy sphere about what's the future going forward.
We'll definitely keep us posted on that. You've been listening to Michaela Savitt, who's our state government reporter here at Connecticut Public. Michaela, always a pleasure having you on.
Thanks so much, Kat.
Thanks for the updates. And Dr. Danelle Luciano will be staying with us for the hour. Coming up, we'll ask how federal funding cuts for research might impact menopause, PCOS, and endometriosis. You can join the conversation. Let us know if you have any questions, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. The Trump administration is attempting to slash funding for various medical studies. On top of that, federal agencies are scouring grants for words like women, assigned female at birth, and more. That's activating fears that funding could be eliminated or reduced for research areas like reproductive health. This hour, we're exploring how these moves could impact research on conditions like endometriosis, PCOS, and more. Still with me is Dr. Danelle Luciano, who's a professor of obstetrics and gynecology at UConn Health and also co-director of EndoRISE. Joining us now is also Julie Ravner, who's a chief Washington correspondent for KFF Health News, which is a health policy research and news organization. Julie, thanks so much for joining us today.
Thanks for having me.
And we also have with us Dr. Lubna Paul, who's a professor of obstetrics and gynecology and reproductive sciences at Yale School of Medicine. Dr. Paul, appreciate you coming on as well.
Thank you so much. Absolute pleasure.
And for our listeners, let us know if you have any questions. Give us a call, 888-720-9677, or find us on Facebook and Twitter at Where We Live. So, Julie, what research topics are being targeted by the Trump administration right now that you're covering, and can you tell us why?
Well, as you mentioned, anything that has to do with women or minorities or equity or inclusion, it is a long list of things that grants are basically being scoured, and something that I've never seen before, and I should say that I've been covering health policy in Washington, including the NIH, since 1986. I've never seen an administration go in and cancel ongoing grants. It's one thing to say, going forward, we're not going to fund this or that, but I've never seen them say, we're just going to cut you off right now. And that's what's happening. And that's why we're seeing so many universities around the country basically pausing admissions for PhD students because they don't know if they're going to have the funding for a student studying sciences. It's really unprecedented. One of the NIH has been a bipartisan favored program in Washington for as long as I can remember. It was the Republicans who led the effort to double funding in the 1990s and early 2000s. And Congress tends to, if not micromanage this program, at least manage it closely. So things like requiring that clinical studies include women and creating an Office of Women's Health are things that Congress did. And this administration seems, bent on basically just eliminating all of that.
Well, and then we're going to go into more details, too, in terms of there's a lot of ripple effects that could happen if these funding continues to be frozen, essentially. And we're going to be talking more about the impacts as well. But also at the top of the show, we mentioned the disappearance or scrutiny on specific words and terms like women or assigned female at birth. And these are what's happening right now under the Trump administration. Why is that a concern among researchers, Julie?
Well, obviously, we have ongoing research. We have congressionally mandated ongoing research, as we know, and I'm, surrounded by two very eminent doctors who can explain this better than I can. Women are biologically different from men. And for years and years and years, we had all of this research that only happened on men. partly because the researchers didn't want to confuse their results, things like hormones, which could get in the way of figuring out how things worked. And also, as Dr. Luciano said, because particularly women of childbearing years, there was a concern that if they were to get pregnant, there could be some danger to the fetus. So it was both to protect the research and to protect the research subjects. But as a result, we ended up for decades really not knowing how many medical interventions, not just drugs, surgeries, other treatments, worked differently on men and on women. And obviously, in the couple of decades since then, we found out that it is very different indeed.
Well, you mentioned just now, too, that, of course, I think we're all hearing about funding cuts to research and how that's going to impact a lot of these areas. Can you walk us through those in a bit more detail? Are these funding cuts technically legal?
We don't know. Certainly the continuing resolution that just passed Friday night allows the administration to reduce, not by an enormous amount, but reduce discretionary funding. NIH is part of that discretionary funding that could be reduced. There are obviously many, many court cases now challenging the freezing of these grants, the termination of these grants, the termination of many employees, the DEI executive order itself. So it is all yet to be seen how legal this is. But I think what has surprised me most in 40 years of covering Congress is that Congress is basically sort of sitting back and letting this happen. A Congress that tends to be incredibly active about what happens and how in biomedical research has basically just let the administration, take a sledgehammer to it.
And Dr. Paul, much of your work centers on PCLS, which we've been talking about, stands for polycystic ovary syndrome. Can you tell us more about PCLS? How prevalent is this condition, and what do we know about it?
Absolutely. Well, thanks so much. I just want to thank Julie for bringing up, addressing the questions in such a broad and deep manner. I just want, if I may, just make a point here. Sure. As a clinician and as a clinical researcher, I want to underscore it's not about women. I'm a gynecologist. I've been taking care of women for almost 30 years, but I come to this forum to say it's not about women's health, it's about population health. All the diseases that we talk about translate. So endometriosis is not just a disease of the woman. There's a male repercussion. Women, and Danielle, you are more equipped to answer this, but I just want to bring it up that sons and brothers and probably fathers of women diagnosed with endometriosis, it's just understudied. What are the implications? Similarly, you talked to me about polycystic ovary syndrome. The focus is on female biology, but there are phenotypes. There are implications for transgenerational implications of these entities. So I think we have to come to these disorders and conditions with a way bigger, broader lens, because our commitment is to population health. And we can't compartmentalize. So back to then your question to me, PCOS, polycystic ovary syndrome, it's a label. It's a very easily flaunted label. It's a very misdiagnosed condition as well, from my vantage point. It's an overdiagnosed condition. We are very trigger happy calling somebody PCOS a little bit too early in that evaluation process. But ballpark, anything from 10 to 13% of the population meets criteria for earn this label of polycystic ovary syndrome. I think the challenge with this entity, there is one aspect is overdiagnosis. There is one aspect of poor understanding. And there is one aspect of almost naivety, thinking the patient's perspective that there's only I have PCOS, there should be a treatment to fix it, right? It's like blood pressure problems, take an antihypertensive. PCOS, there must be one treatment. And the frustration at the level of the patient population is because physicians, the caregivers, are not able to clarify to the patient what is happening to you. And the patient is really, there's challenges in access to care. There are challenges in quality of care received to the satisfaction of the patient. And the reality is it's it's like a big fresco. There is, or a 1,000-piece jigsaw puzzle. It's a picture coming together with many different underpinnings. So I'm sorry for the verbosity of my response, but I just want to underscore it's not one entity. It's a PCOS is a picture.
Right, and you did help us understand sort of the broader picture, and also we mentioned earlier sort of the ripple effects of a lot of these and how they're very much interconnected in ways that perhaps we haven't really taken the time to think about. And Dr. Luciano, anything you want to respond to here?
I mean, I couldn't agree more. I think, there's a genetic factor that's associated with endometriosis and with polycystic ovarian syndrome, and they are not just one entity that affects one group of people. And we need to understand the disease better, to understand the genetics, and to understand how it affects everyone. And I love how Dr. Powell says it's population medicine. I mean, we can't understand the population unless we understand all the components of the population.
And Dr. Paul, we're talking a couple different underdiagnosed or understudied diseases here or illnesses, and because you're also the director of the menopause program at the Yale School of Medicine. Can you also talk about menopause and whether or not is understudied, misunderstood, and is there relief out there?
I'll start by answering there is absolute relief out there, but I also want to frame it in the context that menopause is a normal phase of life. It's not a disease. You live long enough and you step in, and it's like puberty. For some women, it can be challenging, and there's absolute clarity in terms of options available. The challenge with reproductive aging is, as a society, we approach aging as a problem, right? We are underprepared. We don't have conversations about aging when we are younger. We are sort of blindsided till it hits us. And most of the challenge and as I have gotten older, the more the understanding is that if only we did not, it's almost like a stigma. Aging is approached with a stigma rather than embraced, that, hey, we are privileged to be living into that phase of life, right? There are many parts of the world where women are dying in childbirth, where women are not even reaching that point. So if only we had more conversations at the younger level so women could understand what the phase of life, what changes do I expect? Because so much of the frustration happens that the woman is going through, and 70 to 80% of women, as they transition into perimenopause and then menopause, have some symptoms which they are not prepared for because they never had those conversations with their elders and their families. There's no curriculum in that, in our journey to prepare us that, what lies ahead. So there's a lot of ambiguity. And many a times, by the time a woman reaches that clinician to even discuss that, I don't know what's happening to me. She has suffered, and it's not just her environment, her work has been impacted, her family probably has been impacted, her relationships may have been impacted just because of there's lack of sleep. I have to say, of all the things, if you cannot sleep well, it bleeds into every facet of your life. So the burden of reproductive aging and menopause, a part of it is we as a population are not prepared. We're not. So I'd say knowledge is power. If we could have those conversations, empower the women, so when they approach, they should early in that symptomatic burden, they can reach out to their physicians to really talk about what's happening to them. And I would even, and this is again, what I'm sharing is my personal opinions, not institutional, personal opinions, but I would underscore that I think we as a workforce, as a clinical workforce, are also underprepared to address the needs of the aging population. And there is something called andropause too. Men also do have aging phenomena going on. It's just that orchestra is silent. Nobody else can see it, right? Whereas women undergo cessation of menstruation, and there's this hallmark that happens. So I would encourage women to really have these conversations well before that phase of life arrives, so they're better prepared. And I would really go out and shout it out that there are lots of treatment options available. And it's like we have a toolbox with lots of tools. Which tool to pick for which patient? That's where the art of medicine comes in.
Well, and I think as we dig into that toolbox too to see what works for us, because clearly this is a case by case basis and depending on the person, right? Julie, I would love for you to kind of take us back in the past a little bit, because we learned that the year 1993 was a really important year for women and other marginalized groups in the world of clinical research. Can you tell us about your experience covering the battle to have them included in studies, which is something that we touched on a little bit earlier?
Yes, in the early 1990s, a number of women in Congress, and there were just beginning to be enough women in Congress to actually make things happen, discovered, I think what touched them off was the study, the famous physician study that recommended an aspirin, a baby aspirin a day to prevent heart disease, and the discovery that was tested only on men. No idea what that meant for women. And they kind of made a stink, and they, as I said, Congress, it pretty closely manages the National Institutes of Health, and they helped push the creation of the Office of Women's Health Research. It was codified in 1993, so it does exist in law. In fact, I would add that just last year, the National Academy of Medicine recommended that it be elevated to a full institute. Unclear if that's going to happen. I would doubt it at this point, at least under this administration. But, this was a push to require that women be included in clinical trials, which, as we discussed earlier, they were not for a variety of reasons. The good news is that more women are being included in clinical trials. The bad news is that we don't always see that in the results of these clinical trials because they don't always break it out. So it's all still quite a work in progress to not just get women studied, but to figure out what the differences are.
And Dr. Luciano, especially with building on what Julie just shared, and I'm not going to lie, the fact that it was in the early 1990s kind of blew my mind a little bit in terms of the timeline. Is it fair to say that because of these barriers, because of the timing of this, the science behind women's health is still catching up?
I think that's part of it. But I also think that we need to start the conversation, like Dr. Paul said. We need to be more vocal about these otherwise taboo topics. And again, maybe that can't happen in these next 4 years, but if we don't start talking about menstruation and the beginning of it and what happens during it and the end of it, then we're not going to be able to understand it, and we're not going to be able to even come up with the research that we need to come up with to find the treatments or the options to help women during all of these times and with any conditions associated with reproductive health. So yes, for sure, mandating that we study women is important, but we have to actually come up with the studies, and we can't come up with the studies unless we have the conversations. And that's why it's important that researchers and doctors and advocates and patients all work together to bring these issues to the forefront.
Well, and actually continuing that building block in this conversation, Julie, with, Dr. Paul, can you help me understand what federal freezes would do to the progress that scientists has made, as Julia mentioned earlier, about the freezes and the potential freezes that we're seeing today, and also with what Dr. Luciano just shared, particularly needing studies to happen and also studies that are actually on the brink of big discoveries?
Gosh, it's tough to even respond because I think Julie covered it in depth. The impact, the spectrum of impact is so profound. There is the studies which may have been on the brink of discovery, where zillions of hours and innumerable dollar amount has already been invested, and they are probably literally on the brink. And to abort those efforts, I think that these are grades of tragedies, possibilities, right? So there is that part. Then there are, cutting edge thoughts that have been, the studies that have matured, the concepts that have been matured to the point of now you just need the dollar amount to get, the rubber hits the road. And they have been, it's not possible. The impact of this freeze on the careers of brilliant minds is cannot be fathomed. I know a fraction of people, but I know so many people who are at a point where their projects are halfway through and they don't even know if they will have support to support the staff that were employed and have matured to a stage where now the studies were literally on autopilot. So much of nurturing of personnel to a point that, no single mind can achieve goals. It's a team effort at the end of the day. So the impact for those projects, and then travesty to my mind is the future generations. Now, all of a sudden, the high schoolers, the kids, the college goers, suddenly you have identified that, wow, commitment to science, your career could be at the, some policymaker could decide that your entire career could just go out in a whiff. So what would that do to, we means the scientific community has such a focus of efforts had been how to expose young people, young minds, incoming generations to the power of investment in science. And again, it's towards a better world. So I cannot weigh which is a bigger burden here than the other, but that's the spectrum of happenings. And again, I'm sharing these perspectives literally as a clinical researcher who my patients allow me to question, but why is this happening? How can we understand and help? I then partner with translational research teams who take the question from bed to bench so that we can unravel mysteries and then bring them back to the bed. And I think it's just, if there was any thought in this pause to say, maybe future funding will be halted while ongoing projects will continue till whatever that philosophy was, if it was structured in some way, maybe the potential for harm could have been mitigated. But that's my perspective. It's just, it's difficult to even put it into words.
Well, before we go to break, Dr. Luciano, especially with what Dr. Paul just shared about sort of the collective effect, can you talk about your perspective? What are some of the long-term impacts of funding cuts for medical research on understudied conditions could have from where you're sitting?
Well, how it's just the research and medicine is not a sprint, it's a marathon. And if we stop anywhere, if any of you are runners, I'm a runner, if you stop in the middle of your half marathon, it's really hard to get started again, right? The same goes with research. And what this has the potential to do is not only stop the ongoing marathons, but to stop some from starting. And it makes me so sad to think about what Dr. Paul was saying, that all this effort we put into increasing STEM, especially in young women, trying to get them into science and medicine, and then to turn around and say to them, we really want you to do this, but at the whim of somebody else, your research could be gone and your job could be gone. And that's not something that, an 18, 19-year-old wants to hear on their way to college.
You've been listening to Dr. Danelle Luciano, who's a professor of obstetrics and gynecology at UConn Health, Julie Ravner, who's a chief Washington correspondent for KFF Health News, and also Dr. Lumna Paul, who's a professor of obstetrics, gynecology, and reproductive sciences at the Yale School of Medicine. We'll continue our conversation on federal funding cuts to research after the break. Give us a call. Let us know if you have any questions, 888-720-9677, or find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. This hour, we're talking about how federal funding cuts and other steps taken by the Trump administration could impact research into reproductive health. And still with me is Julie Ravner, Dr. Danielle Luciano, and also Dr. Lubna Paul. Julie, I want to jump to you here. Talked a little bit earlier about how you are surprised by a lot of these changes over the course of your experience, your very in-depth experience covering health news. But I do want to ask again, do President Trump's funding cuts for scientific research, especially relating to the National Institutes of Health, did that announcement come out as a surprise for you?
It really did. Like I said, this is something that has been supported by Republicans and Democrats over decades, been built up. The U.S. obviously leads the world in biomedical research. And I think that what the doctors have been saying about what this does to the pipeline of future researchers cannot be overstated. We're seeing researchers for the first time ever thinking of moving to other countries to do their research. France is basically inviting researchers to come there to pursue research that people fear they can no longer politically pursue in the United States. This is the first time we've ever had this sort of a situation, plus just the uncertainty of, can your research grant be canceled in the middle? Can your study section that Dr. Powell was talking about, that's ready, that you've been working on for years, that's ready for funding, that just needs the advisors to meet and give it the go-ahead. They can't meet because the institutes at NIH aren't allowed to publish in the Federal Register. I happen to live up the street from the NIH, so I know a lot of people who work there. I've never seen morale like this. People just don't know what the next shoe is it's going to drop.
Well, and actually, you might have just answered my question with that last comment there, but because we've been focused more on specific illnesses or diseases and whatnots in this particular conversation, but can you also expand on what are other areas that could be impacted by what's been going on as we're speaking?
Well, obviously, the entire health agency, the Department of Health and Human Services, is part of what's being targeted by this effort to root out what, the administration calls DEI, diversity, equity, inclusion. And as you mentioned, there's this long list of words that are now being sought so that things can be basically defunded. Just the amount of taking apart the federal government, and as you asked early on, is this legal? Probably not, but who's going to stop them? I mean, it's sort of like do things first and ask permission later. It seems to be the theme of this administration, and people are trying to fight back, but the cuts are coming faster than people are able to actually go in and ameliorate them.
Well, another quick question here related to that too. Beyond patients and providers that we've been talking about today, could also Big Pharma be impacted by these cuts?
Big Pharma could be impacted by these cuts. And a whole nother issue is sort of the quietness of a lot of the stakeholders here, people who are not speaking out, people who've basically been cowed by this administration. They fear retribution. They legitimately fear retribution. We have seen retribution, cast on individuals and organizations. So you get organizations who you would normally be expecting to go to the barricades, who are being very muted in their reactions to some of these things. Whether some of these groups will find their voice kind of remains to be seen.
And Dr. Luciano, earlier we talked about your hopes that EndoRISE will promote more research and more awareness across the country for endometriosis and related conditions. Can you still accomplish that goal without the support of federal government?
Yes. And the goal is to be able to, like I said, distribute some of our biospecimens and become a part of this larger research organization. But if pharma is not able to participate in research or is being muted, if other research sites are being muted, then eventually that's going to trickle down to us as well. And so I think our goal has to be on raising awareness to what this will do. And I have to believe that in the end, the right thing is going to happen.
And Dr. Paul, any final thoughts to close out the conversation? What do you hope our listeners take away today?
Oh, gosh. Well, first of all, thank you so much for this conversation. I, you know, there's a lot of chaos, there's a lot of uncertainty, but I believe there's a lot of hope as well. And I hope that we can stay focused. There are solutions, there are in conversations. And I think we cannot let the doom and gloom of the present shape our perspective. So I would want the listeners to take away that they need to have conversations about about what is bothering them, because in the clinical space, there's lots of hope, right? There are lots of tools that are still existing, and bother can be harnessed, risks can be reduced, but it requires a bi-directional communication. And I would just encourage our listeners to take ownership of their own health. So when they go seek care, they ask directed questions of the provider, because an educated customer, aware customer, can maximize the yield of that interaction with the healthcare team.
Well, actually, a very quick follow up there, especially for a lot of people, maybe this is their first time and it can be intimidating going to a medical office or even just asking a question. We've got about a minute here, but what would be a suggested first question for them to ask?
I think the awareness of health. So I come back to say painful periods is not normal. If they're having, they need to be coming to the provider asking, but bringing that to the surface. Irregularity of menstruation may be a reflection of a problem. Don't just accept it. There's so many young girls with periods, it's okay. No, it's not. So become aware about your own biology. Because once you are aware, you can bring it up at a much earlier point so that action can happen.
All right, so take care of yourself, and not only are we spreading awareness of information, we also have to be aware of our own health as well. Well, I appreciate that tip there. And really quickly here, Julie, as we look into the future, what are some of the things that you're looking out for in the next couple of months?
Well, I'm going to see whether the pushback, comes. Having covered health and science for this many years, seeing so much support for it, to see it sort of dismantled in the space of just a few weeks, is really kind of shocking to a lot of people. I think when people get over the shock, we'll see, whether the fight really sort of digs in.
And any final thoughts for our listeners, and in terms of what do you hope they take away from today's conversation?
Just to be aware of what's going on. I think a lot of people think that, the news is pretty grim for a lot of people, but it's important that people see what's going on and make their voices heard.
Well, thank you so much for that. You've been listening to Julia Raffner, who's the Chief Washington Correspondent for KFF Health News. Julie, thank you so much for your time today.
Thank you.
You are also listening to Dr. Danelle Luciano, who's an Associate Professor of Obstetrics and Gynecology at UConn Health and also the Co-Director of EndoRISE. Dr. Luciano, thank you so much for joining us today.
Thank you.
And also Dr. Lubna Paul, who's the Professor of Obstetrics, Gynecology, and Reproductive Sciences at Yale School of Medicine. Dr. Paul, thank you so much for being on the show as well.
Thank you so much.
I'm Catherine Shen. Today's show is produced by Chloe Wynn. Our technical producer is Dylan Reyes. Download Where We Live anytime on your favorite podcast app. Thank you so much for listening, and take care of yourselves, everyone.